Hello, friends. Let's learn about evaluation of acute diarrhea. First of all, what is acute diarrhea? Any diarrhea which lasts for less than 2 weeks is called acute diarrhea, and mostly acute diarrhea are of infectious in nature. Okay, so from history and physical examination, we have to rule out. We have to make an idea whether it's likely of infectious origin or of non-infectious origin. Mostly non-infectious origin of diarrhea is associated with some other diseases like thyrotoxicosis, okay, thyrotoxicosis, diabetes mellitus, or consumption of some food containing sorbitol or like that. And you have to evaluate and treat them accordingly. After that, after you have decided the diarrhea is somehow likely to be infectious in origin, okay, you have to know your patient has got mild diarrhea, moderate diarrhea, or severe diarrhea. If your patient has unrestricted activity, they can do their usual activities, then that's called mild diarrhea. For mild, moderate, or severe diarrhea, whichever the case is there, if you think your patient needs fluid and electrolyte replacement, you have to do first. Okay, this is most important thing. The survival of the patient depends on fluid and electrolyte. Okay, after that, if you think the patient has got mild diarrhea, then for mild diarrhea you can just absorb them. Okay, and if it resolves, fine enough. If it do not get resolved with observation alone in case of mild diarrhea, then you should use metronidazole for certain days along with stool microscopy studies. Okay, but if you think your patient has got moderate diarrhea, your somehow their activities are altered, then after fluid and electrolyte replacement, you have to look out for few things like if there is fever which is more than 38.5 degrees centigrade, body, there is bloody stool, there is increased fetal WBC if the patient is immunocompromised or elderly host. If any of these things are present, if any of these things are present, then they need stool microscopy test. Okay, stool microscopy studies. But before that, you can always try quinolones like ciprofloxacin. Okay, but if your patient do not have any of these, okay, fever, bloody diarrhea, stool WBC, there is nothing like that, then you can try antidiarrheal agents like metronidazole. Okay, and if it resolves, it's good. If it persists despite using metronidazole, then at that time you have to do a stool microscopy test. For severe incapacitated patient, you should always do stool microscopy test. Okay, and if your mild diarrhea or moderate diarrhea which which is persistent, okay, despite treatment, or your severe diarrhea which you have done stool microscopy, if you find pathogen, then you have to treat that pathogen. Specific treatment should be done. If you do not find pathogen, then you can always try empirical treatment for a few days, and but you should always evaluate further like sigmoidoscopy, colonoscopy, meticulous blood examination. Okay, you have to evaluate for other causes as well. Thank you. This much for today.